Hello, welcome to Bradford Dental Clinic. Today I would like to spend a few minutes talking about gum disease because this is a question that we get asked quite a lot when a patient makes an inquiry. People often tell us that they've been told by their own dentist that they've got gum disease, or they've been on the internet and they've asked ChatGPT, and ChatGPT has told them that bleeding gums or receding gums or painful gums when brushing are all signs of gum disease. And I think this is something that people get really very confused about because there's lots of different signs and symptoms. So let's talk about gum disease today. Gum disease is often characterized by painful bleeding gums. This is the most common symptom that we see. In addition, people sometimes report that it can be painful when brushing their teeth or when they try and use floss to clean in between the teeth. People can struggle, and this is something that is very, very common. It can be treated, and there is treatment for gum disease. However, as with many health conditions, the sooner you seek treatment, the easier treatment is, and the more likely that we can hang on and maintain the health of your teeth and gums for many years to come. There are some well-known risk factors for gum disease, and I'll just list a few of them now for information. Smoking and vaping is the biggest risk factor that we know of. Being diabetic or being low in vitamin D or iron, this is another very well-known reason for seeing inflammation of the gums. Patients who maybe haven't had a dentist for a long time or haven't ever had professional tartar removal with a dentist or a hygienist, this is another very common thing that we're seeing, and the reason why we're seeing more and more problems like this is because if you've never had a removal of tartar, that tartar is just sitting there and causing further inflammation and recession. So if you haven't had a dentist visit for a long time, or if you have a dentist and never seen a hygienist, it might be an idea to come along and book a hygienist appointment to try and help remove any buildup of tartar. These are the biggest risk factors really. It's about plaque control, it's about what we do at home in terms of plaque control, it's about not smoking or vaping and trying to be as healthy as we can, healthy lifestyle, healthy gums. If you think you may have gum disease and you want to come and see us, please give us a call on 01274 003333. We will book you in to either see a dentist if you want a full assessment and you want an x-ray and diagnosis, and then we'll be treatment planning and deciding what the next steps are. If you have a dentist and you just want to see the hygienist, you are welcome to come and see our hygienist directly. However, if you're unsure what the best option is, give us a call and we would love to advise further.